Hello, my name is Sierra Robustolini, and this is my health promotion program, Get Healthy Port Lions. The target population of this program are the residents and families within the community of Port Lions. The overall aim of this program would be to create community-led combat to increase knowledge of obesity-related issues, expand access and involvement in physical activity, and to implement solutions in order to better nutrition for community members of Port Lions. As a general overview, the Phase 1 goals, which are to be completed within the first year of the program, are to create interventions to increase awareness and knowledge of obesity-related issues and to promote better nutrition in both the community and school. The Phase 2 goals are to be accomplished at a later date in the program preceding the completion of Phase 1. The Phase 2 goals are to increase ways for the community to have access to fresher fruits and vegetables and to create various places within the community for physical activity and implement different outreach activities for increased physical activity. There are process, impact, and outcome objectives to support the program goals. These objectives are specific and apply more to the completion of the program and will be used as evaluation tools. The need for this project is almost a no-brainer. Looking at the need for obesity-related health promotion projects within rural areas at a national level, the need is significantly there. A study found that 39.6% of rural Americans were obese, compared to 33.4% of urban Americans. Rural residency is a risk factor for overweight children as well. Looking at the data more closely to the local level within the Kodiak Island borough, rates of obesity have reached 30%, which is well above the 2013 national benchmark of 25%. According to the Department of Health and Social Services of Alaska, 27% of Alaskan adults are not getting the recommended levels of physical activity, and access to healthy food in local stores has been judged to be difficult or nearly impossible for 15% of Alaskan adults. Get Healthy Port Lions would be able to promote change in the obesity epidemic by providing individuals the education and resources to develop healthier habits as well as ensure the environments they live in support healthier choices. The first step in being able to implement the program is to create community coalition groups with the school district, City of Port Lions and the Garden Club, the health clinic, the local tribal, and various community members. The participation and help of these various organizations are vital to the success of this program. These representatives will form the work group who will be a big help in the planning of Get Healthy Port Lions. Effective communication is essential for the success of this program. Social media, such as Facebook, will give the planners opportunity to keep the community up to date on certain projects and events. The Facebook page will also be used to provide tips each day that are aimed to healthier lifestyles. Audio visuals of events will also be posted at the local post office, school, and city hall. In order to properly evaluate the program, pre- and post surveys will be given to community members before the program begins to gain a better insight of their habits and their overall interest in the program. Post surveys will be used to assess the knowledge gained and the overall success of the program. A rural community within California that has similar goals and similar evaluation tools, such as the surveys for Get Healthy Port Lions, found their efforts to be successful. From their evaluation, they found that their program demonstrated that it is possible to improve access to fruits and vegetables and physical activity spaces in historically disadvantaged and under-resourced communities at the local and regional levels. This gives insight to the success of Get Healthy Port Lions. The selected evaluation tools will measure both Phase 1 and Phase 2 strategies. The Phase 1 strategies are to work alongside or with the school district to provide better nutrition within the schools, have locals donate fish that is caught locally to the school lunch program, support the school in order to maintain regular open gym hours for all community members. This would include working with the travel program to get consistent regular gym hours. Encourage community members to engage in physical activity by providing free exercise classes, provide community walking groups that happen 3 times a week, and encourage children in kindergarten through 6th grade to participate in the Healthy Futures Challenge, a statewide incentive-based challenge that encourages Alaska's kids to get out and play every day. And lastly, The last strategy would be to provide community support groups and workshops for community members to be able to talk with each other. Participants will meet 2 times a month to learn about various obesity-related issues and tips on how to make healthier choices. There will also be a social media Facebook page set up to keep community members up to date on happenings as well as tips of the day related to health and physical activity. The Phase 2 strategies, which are to be completed at a later date, are to gain access to new and safer walking and biking trails throughout the community, as well as create a community greenhouse or garden that could supply community members with fresh fruits and vegetables. The garden club would be incorporated to help. In order to achieve the anticipated results, the trans-theoretical model will be used. This model uses stages of change to integrate processes. This model will allow participants to proceed through their behavior changes at their own pace and give community members more incentive to adopt the program because it will allow them to participate in the intervention as they choose. It is understood that everyone will adopt this program at different rates. In regards to the budget, the hope is to have plenty of donations from the community organizations. Myself, the planner, will also be responsible for making sure all costs are covered. There will be no cash required for the personnel because they will all be volunteers. The City of Port Lions will donate the City Hall at no charge. Planning meetings can be held here as well as other meetings that may be needed. The biggest expenses are the office supplies and the dome greenhouse. The office supplies are when copiers and computers are needed and the money will be able to buy ink and paper. The dome greenhouse will be a 40-foot dome built by Arctic Dome Greenhouses. The $1,000 will provide the jump start for various edibles to plant inside the greenhouse. Upon completion and implementation of the program, the community members and local garden club will be responsible for upkeep in the greenhouse. The timeline for Get Healthy Port Lions spans over 2 years. The program rationale, needs assessment, development of goals and objectives, and creation of an intervention have already been completed. The timeline will be adjusted as needed. Port Lions community could be one of the first villages within the Kodiak Island Borough to begin to combat the obesity problem. In order to reverse the direction of obesity rates, it is vital that an obesity prevention program be implemented. Get Healthy Port Lions will be a program that can provide the individuals the tools they need to begin a new start to healthier habits and lifestyles.